Welcome. 5 people, please. If you are coming, like this program. Like this program. Like this program. Share and like. I'm not supposed to be reminding you people to share the program. Once you enter, you share and you like. So if you are coming, please. If you are watching this program, I want you to come with your pen and paper. Especially if you are having fibroid cysts. Bring your pen and paper. We are going to talk about everything about fibroid cysts and what you can do naturally to shrink them or to remove them. So if you think that I hope you people can hear me clearly. If you have fibroid cysts, please come here with your pen and paper. I'm going to give you some minutes to get your pen and paper. As you are joining, come with your pen because we are going to talk about everything about fibroid so that you will know the one you are suffering and you know what to do. So I'll start in the next 2 minutes. I'm giving you opportunity to get your pen and paper ready. This is a very important topic that is affecting most of the women, especially those who want to get pregnant. Even if you don't want to get pregnant, living with fibroid is not an easy thing, except especially those who have a very large fibroid in their uterus. So get your pen. If you are ready, you tell me, let me start. If you have pen and paper, because when you ask me question, I would know. From your question, I will know whether you are listening or you are writing something down from what I'm talking about. So welcome, share, like, support the program with star if you can. If you're in a country that supports that. So today we are going to be talking about fibroid cyst, all you need to know about fibroid, and the things you can do on your own apart from surgery to shrink, to make the fibroid dies off. Remember, the reason why the fibroid is growing is because you are still at the reproductive stage. So if once you enter menopause, the fibroid will die because the estrogen will stop producing. Comfort, my sister, you are welcome. Yes. Okay. Who else? Only Comfort is here. I'm seeing only Comfort here. So let's start. Now, before I tell you the things you will do to shrink fibroid and what you can do to reduce fibroid in your home or by yourself, we need to look at what fibroid is. What is this fibroid? What is this fibroid that is preventing women from conceiving? What is this fibroid that is causing infertility in women? You need to know what fibroid is all about. Then the types before you know the one you are suffering. It's not all the fibroid that is harmful or risk for conception. So the reason of this video, disclaimer, this is just to educate women on how to go about reducing fibroid that have been causing infertility among women. So now, what is fibroid? Fibroid are non-cancerous growth that develop in or around the womb. That is uterus. Whenever you hear uterus and your womb, they are the same. The growths are made up of muscles and fibrous tissue and vary in size. They are sometimes known as uterine myomes or linomyomes. Many women are unaware they have fibroids because they do not have symptoms. Sometimes when you go, some doctors don't refer it as fibroid. They will tell you you have uterus myomes. You'll be confused. So whenever they tell you you have uterus myomes, it simply means that there is fibroid. So their size differs. Now, but the fibroid that disturb women, every woman under the productive age have it. but some may not know because it doesn't give them symptom, or maybe they don't notice the symptom. As long as you are under reproductive age, you will continue, you will have fibroid, because this they feed from estrogen. But women who have entered their menopause may not have these symptoms. Now, this fibroid that is affecting women now is called uterine fibroid. That is the fibroid in your womb. Now, what is uterine fibroid? Uterine fibroid are tumors that grow in a woman's womb, that grows in your uterus. These growths are typically not cancerous. Uterine fibroid is also called uterine myomes. So, have you been diagnosed? Have you been told that you have uterine myomes? Now, let's look at how this uterine fibroid can affect your fertility. Somebody may ask, how can uterine fibroid affect my fertility? How can it make you not to conceive? How can it make you to become infertile? Now, uterine fibroids can partially cause infertility by blocking the fallopian tubes or stopping a fertilized egg from implanting in the uterus. Large fibroid may prevent a fetus from growing when it is large. That's why I tell people, whenever there is fibroid, large one in your uterus, my advice is for you to do something, either by going for surgery, or you do the things that I'm going to be telling you with your heart. You do it with determination, with your mindset. Within 6 months, maybe the fibroid will be shrinked. So uterus fibroid can partially cause infertility. One, how does it cause infertility? By blocking your fallopian tubes. And you guys know what fallopian tube is. Fallopian tube is a place in your body where the sperm pass through to go and meet the egg and fertilize it. So when these tubes are blocked, there's no how the sperm can get to the egg. So uterine fibroid can block your fallopian tube, can prevent the sperm from swimming to fertilize your released egg. A fertilized egg from implanting, it can also stop a fertilized egg. If the egg have been fertilized, that is, if the uterine fibroid did not harm or prevent your block your fallopian tube, and eventually the sperm managed to go to the egg and fertilize it, this same uterus fibroid can also prevent the fertilized egg from implanting, because this fibroid is implanting in the place where the egg is supposed to implant. So in the uterus, large fibroid may prevent a fetus from growing due to decreased space in the uterus, because the fibroids have already occupied the place where the fetus or the fertilized egg is supposed to implant. The fibroid have occupied it. So just like you building a house, and then all of a sudden another person will come and take over your house, there's nowhere you can live. Even if you force yourself to live here, live there, you will be struggling with the person to live in your house. Or maybe you are sitting in a chair, or this is a chair you're supposed to sit. Somebody, immediately you stood up, somebody will go there and sit. When you come back, you'll be struggling with the person to sit. That is how uterus fibroid affects infertility. It may prevent the area it can cause infertility. One, it will either block the person's fallopian tube. I have talked about fallopian. I hope you guys are writing. I hope you are writing, because when you ask me question, I will know whether you wrote something from what I said. And if you have fibroid or cyst, you pay attention to this thing, to this lecture, especially when I'm going to be talking about things you can do to help yourself. Even if you undergo surgery, you can remove it. Within some months, the fibroid can go back, because the estrogen because you are not doing the real things that you are supposed to do. So sometimes surgery is not the best solution to fibroid, because there's some things. That's why I keep on telling you people. Somebody wrote me this morning, say I have hormonal imbalance, what can I take to balance it? What will I tell you to do when I don't know the hormone that is not balanced? I don't know if people are listening to what I'm saying. I am not deceiving you guys. I'm telling you nothing but the truth. It's always good for you to find out the root cause of your problem. Find out the hormone that is not balanced. Stop seeking for help online. If anybody writes me, what can I do to do this? I will block you. Go to your doctor, go and do hormonal test. Then you can ask. When you know the hormone that is not balanced, you specify it. Even your doctor can prescribe something for you. So it's always good. If this fibroid can be managed, it can be managed no matter the size, depending. If you are doing all these things I'm going to say now, the if you have large fibroid, like, you can compare yourself with somebody who have 2 centimeter fibroid to somebody who have about 20 centimeters. So long the interval of healing differs. So if you are watching me today, only one person from TikTok, so assuming I now would have been streaming on YouTube. So always find out the root cause of your problem before you start seeking for solution. Now, I talked about how fibroid can affect your fertility. One, it can block your fallopian tubes. There's nowhere sperm can swim to meet the egg. The second one, it can prevent the fertilized egg. If it did not block your fallopian tube, it can prevent the fertilized egg to implant, because especially when you have large fibroid, they will go, and I posted the picture there. Let me see now. Let me see if I have this picture here. If the fibroid is very large, like you can see now, this is the fibroid. This is the multiple fibroid now. So this is your uterus. So if the fertilized egg want to implant, the fibroid have already occupied the space, so the egg cannot implant again. And also, fibroid can also prevent, when the egg implants successfully, because of lack of space, the fibroid can make the egg not to, the fertilized egg to develop. Now, please take your pen and paper, except if you are not suffering from fibroid. Let's look at the type of fibroid so that you will know, the one you are suffering from. Now we'll have subserosa fibroid, subserosa fibroid, subserosa fibroid. Subserosal fibroid typically develop on the outer uterine wall. This type of fibroid can be found outside your womb, and this type do not affect your fertility because the fibroid is outside. It has nothing to do with your fertility. These ones are not harmful for you because they are outside. This type of fibroid tumor can continue to grow outside, increasing in size. The growth of subserosal fibroid tumor puts additional pressure on the surrounding organ. Therefore, the main symptom, or how will you know you have subserosal fibroid, is you always have pelvic pain. But trust me, this fibroid cannot stop you from conceiving because they are formed outside your womb. So I hope you guys get this thing very well. I said the first type of fibroid is subserosal fibroid, the type of fibroid that is formed outside your womb, and this one doesn't affect your fertility. It doesn't prevent you from conceiving. So the number 2 is intramural fibroid. The number 2 type of fibroid is intramural fibroid. Intramural fibroid typically develop within the uterine wall and expand from there. This is the one that grows in your womb and it keeps developing. When an intramural fibroid expands, it tends to make the uterus feel large than normal. As these fibroids grow, they can cause excessive menstrual bleeding, accompanied with pelvic pain and frequent urination. This is the one that disturbs fertility. This is the one that is causing problem in your womb because they are inside your womb. They are occupying the position of your baby where the fertilized embryo will implant, and sometimes they can cause blockage tubes. So if your doctor tells you or your gynecologist tells you that you have intramural fibroid, which means the fibroid is direct inside your womb. These are the type that causes infertility in women. I said the first one is subserosal fibroid. That one is found outside your womb. It's not inside. It cannot prevent you from getting pregnant. It doesn't disturb anything because it's outside. But intramural fibroid is a fibroid. It develop in your uterine wall and expand from there as it's growing. As your estrogen is growing, fibroid is growing, and if you become pregnant, it's even the worst. As your fetus is growing, the fibroid will be growing. The fibroid and your baby will be doing competition. That's why some people who always have fibroid, when they become pregnant, they pass through hell. At the end of they will not even carry the pregnancy to the end. They will be looking for evacuation because of the pains that they will be passing through. And how would you know if you have this one? You will always have pelvic pain and frequent urination. You'll be going to toilet frequently. Now we have another one called submucosal fibroid. Submucosal fibroid. This fibroid develop just under the lining of the uterine cavity. Large submucosal fibroid may increase in size of the uterus cavity and block the fallopian tube. This is another bad one. This submucosal fibroid, these fibroids develop just under the lining of the uterus. The lining of the uterus is exactly the place where the egg implant. So it's harmful for conception, and sometimes when they are big, they can block the uterine cavity. So they may also increase in the size of the uterus cavity and block your fallopian tube. So this one is a very dangerous one, which can cause further causes complication with fertility symptoms. This one is another bad one. Is a very bad one because it glows because they feed from estrogen. And what are the signs? What signs will you know? You know that you have this type of fibroid called submucosa. Then you have you always have a prolonged menstruation, prolonged bleeding, excess bleeding. What I mean by prolonged bleeding is your menstruation seems not to stop. That is not menstruation. Is bleeding. It's not your period. It's bleeding because it's caused by this large submucosal fibroid. The next type of fibroid we have is pedunculated fibroid. Pedunculated fibroid. Pedunculated fibroid. Pedunculated uterine fibroids occur when a fibroid tumor grows on a stalk. So this one is when the fibroid grows in a stalk, and in fact anything uterine fibroid is, apart from the one that grows outside the womb, is not a good thing to any childbearing women because they further cause infertility problems. Uterine fibroid can induce abnormal changes of uterine, including high estrogen level, uterine contractions, and ovulation dysfunction. Fibroid, uterine fibroid can cause you many problems when it comes to fertility. One, it will induce abnormal changes of your uterus, including estrogen level. It may always make your estrogen levels to be high because this fibroid feeds from your estrogen. Now it can cause uterine uterine contractions and ovulation dysfunction. You might not be ovulating when you are suffering from this. So, what are now the possible causes and factors of uterine fibroid? What are the things that is causing you fibroid? There has not been identified factors or things that causes this, but the most likely ones that causes this is one, hormone. This hormone called estrogen plays a key role to stimulate development of the uterine lining. During each menstrual cycle in preparation for pregnancy, this hormone significantly appear to promote the growth of uterine fibroid. Like I told you people, if you have been following my teaching, I told you that we have four hormones that is responsible for conception. One, we have thyroid gland, which produces FSH. We have LG, that is luteinizing hormones that triggers ovulation. We have progesterone. Progesterone supports your pregnancy. Once you become pregnant, your body will signal, the HCG will signal your body to produce progesterone to support the pregnancy. We have estrogen. This estrogen, its work is to go and thicken the lining of your uterus to prepare a place where the newly fertilized egg will implant. So at the process of doing this, estrogen now promote the growth of fibroid in your body. So because of the growth of the estrogen, as the estrogen is growing, your fibroid is growing. So don't worry, I'm going to tell you what to do, natural things that you can do to help yourself out. Surgery is good when the fibroid is in your uterus, is directly in your womb, but then that is not a guarantee. I have to tell you the truth. It's just like somebody going to remove cyst. You may remove cyst, it will come back. The same thing happens to fibroid. If you do not do the right thing that you're supposed to do to stop it, it keep on growing as long as you are still in the productive age, except when you enter your menopause, your estrogen level will be low, then the fibroid will die on its own. But as long as you are still at the age of reproduction, the fibroid will continue to grow. But there are some certain things you can do to make sure that they don't grow, because those estrogen that is making them to grow is no longer there, so they won't grow. So now we are looking at the, I hope you guys are writing. Are you writing, or you are looking at me and my yeye grammar? I want somebody to say yes. Are you jotting something down? If you have fibroid, it's very, very good for you to understand this. There's no ailment, there's no sickness that is so dangerous to us if you know how to manage it. Many people live with HIV positive HIV, but you don't know because they manage it very well. Many people live with a lot of ailment. Those who knows how to manage it, they can give birth, they can do everything without you knowing it, because they are doing the things they're supposed to do. Sometimes we always believe in medication, anything medication. There are ways that you can manage your health, that can make your health more, to improve more than relying or depending on medication. Now, what are the possible cause of this fibroid? I have talked about hormones, and the number one hormone I talked about is estrogen. Estrogen, I told you guys that estrogen is preparing your body for pregnancy by going further to thickening the lining of your uterus so that the fertilized embryo can implant successfully. So at the process of doing this, the estrogen will trigger the growth of the fibroid. Now, heredity. Some people might have this fibroid in their family, so some people might have it as what they inherited from their mother. So another one causes or risk of fibroid is obesity. The risk of uterine fibroid is 2 to 3 times greater in women who are obese. Due to obesity is strongly linked to higher greater of circulating estrogen. So if you are very fat, it could be the reason why your fibroid is growing. When I will be talking about measures, I want you to write it down. If you have fibroid, when I will be giving what you should do, write it down, the food you should avoid. If you can do it for 6 months, you will come and thank me later. So now, what is the symptom of fibroid? What will you see and you know that you have this fibroid? What are the symptoms? I want you to pay attention. What are the symptoms of fibroid? Some people may have fibroid, but they don't know, especially if you have multiple fibroids, multiple fibroid, you might not know. If you have if your fibroid is formed outside your womb, which is called subserosal fibroid, it might not really give you sign because it doesn't interfere in anything. It's just outside, just like somebody coming to your house, staying outside. The person cannot interrupt you or disturb you because the person is not inside. But if the person is inside your house, the person can throw you stone, do you anything. But if the person outside throws something at you, it will only end up hitting on the wall. So now people with what do you call it, fibroid outside their womb might not really have symptoms. People who have multiple fibroids, small fibroid, they might not have, but people who have heavy, large fibroid, it must surely give you these symptoms that I'm going to be mentioned. Write in your book symptoms of fibroid. The first one, the first signs that will show you that you have fibroid is heavy menstruation or heavy menstrual bleeding. Is your period heavy? And when these things occur, you are not ovulating. Is your period heavy? Do you have heavy menstrual cycle? This is the question you should ask yourself. If you have this, then you might have uterine fibroid. We'll have menstrual clothes. Menstrual clothes, sometimes when you are menstruating, you will see your menstruation, instead of coming light like normal period, it will come in form of cloth. I think a bit dark. They will not be real red. You have I wish I could see the picture of cloth, but I believe you guys understand what I'm talking about. So please share. Please share, like 42 people. Please share. If you can support us we start, do that. So menstrual cloth is another signs of fibroid. So another sign of fibroid is a menstrual period lasting longer than a week. Normally, normal cycle for menstruation lasts between 4 to 5 days, 6 days. Once it lasts a week, is now a problem, it's abnormal. That is the sign that shows you that you have fibroid. So sometimes some people ask me, my period is up to 7 days, more than 7 days. That is the sign of fibroid. So another sign of fibroid is pelvic pressure or abdominal pain. Pelvic pressure or abdominal pains during menstruation. Of course, and this is the most common signs with women who have fibroid. During this period of your menstruation, you will have abdominal pains, you have pelvic pains, you have even during love making, you also have this pain. Another sign of fibroid which is causing you infertility is irregular bleeding between menstrual cycle. Some women sometimes, because of the excessive bleeding more than 1 week, it will not give you opportunity to know when you are bleeding. Sometimes it will cease. The blood seems to come out whenever it likes. So that is a sign of fibroid. Now, the last but not the least is frequent urination. Have you been finding yourself frequently going to the toilet, urinating? You have to go and have yourself checked. Now, let's go straight to the remedies. I have two natural things that you can do. Please, your pen, because I don't want somebody to come here and be asking me, ma, please, what did you say? Write it down. Sarah is not here today. Sarah, you are not here. Didn't you get, did Facebook send notification? I didn't see Sarah here today. Sarah, assuming you are here, you would have helped me to write these things down so that even people, because some people don't like listening to the video, they will just come and look at my face and come to Messenger and be asking me questions. Well, if you think that this video is for you, you need it, you need to sit down, because myself teaching, I also make my research before I come here to teach. So you should always sit down and listen to the video and grab your point. Are you guys with your pen? Somebody should say yes. Let me know that I'm not talking to myself. If you are with your pen, I will continue. Once it's 1 o'clock, I will leave. I'll go and pick my children. So it's better you answer. The earlier you answer me, the better for us. Are you with your pens? Nobody is saying yes. Are you with your pens? Have you gotten your pens? Now we want to look at the things that you would do to reduce this fibroid. Now the first thing is this, because fibroids feed from estrogen. So these are the foods that you need to avoid and things that you will do. These foods are the things that is growing this estrogen that is making your fibroid to grow. So when you stop eating those estrogen dominant food, the fibroid will be tired on its own and they will shrink. So avoid food that help fibroid to grow. Food that creates toxicity and estrogen domination in your body. I'm going to be mentioning those food, don't worry. I said the number one remedy, natural remedy of curing, shrinking fibroid is that you should avoid this food that creates a toxicity and the estrogen domination in your body. When you eat food that helps the estrogen, then you are encouraging the fibroid to grow more. But if you don't eat those food, this estrogen will not be dominant, they will not grow large, which means the fibroid will be going down. Now, what are those foods? 1, avoid eating meat, especially red meat, dairy. If you don't get it, you tell me, I will repeat myself. Avoid eating meat, especially red meat, dairy food, alcohol, coffee, processed food, sugar, green vegetable, and fruits. Somebody will say, what are we going to eat there? Yes, it's a sacrifice. It's a sacrifice you need to pay. If you can do this up to 6 months, then the fibroid you will say bye-bye to this fibroid. So the most process or procedure is for you to change your mindset. Let's say you tell yourself you have this problem. Some people are living in a drug. Some people are living on a drug throughout their lives. There's some people that if they don't take a particular drug in a day, they won't live for the next day. So what about you changing your diet? Since this is what is causing you problem, this is what is making you um, uncomfortable. This is what is depriving you from your joy of motherhood. Why can't you do it? Just do it 6 months. And you, after doing it, you go back to the test and you see that if it is 2 centimeter, by then the fibroid will shrink. If it is a large fibroid, okay, I'm going to mention it for the first time, last time. If you ask me again, you pay money. You who asked me this? Josephine David. If you ask me again, you give me star before I open it. You see, I've been drinking water here. My throat is dried. I said for you to shrink your fibroid, whether 2 centimeter or large fibroid, you have to avoid food that help fibroid to grow, and food that create toxicity and estrogen domination in your body. And I said earlier that fibroid grows from estrogen. Now, the number one I mentioned is meat, especially red meat. Red meat entirely is not good for our health. It's not good for your liver. It's not a good thing to eat. So you should avoid red meat. You should avoid dairy foods, alcohol, caffeine, processed food, sugar, green vegetables, and fruits. Avoid sugary things. Fibroid and sugary things. If you have fibroid and you are still eating sugary things, then you are promoting it. All these things I mentioned, you need to avoid it. Do it for at least 6 months. Don't do today and you leave it tomorrow. You need to do it. Place yourself on a balanced diet. Don't eat these things for 6 months. For 6 months, you will see the positive result. Now, another one, you need to tell yourself that you can do this. I could remember when I give birth then, so I was very fat, and I know why I always become fat whenever I put to bed. Because I always do 6 months exclusive. All my children, none of them drank milk from the birth. I always give them natural milk until 6 months. So, and when you are doing exclusive, you need to eat very well so that your child will have something. So, but then at the process of eating, I became so fat, so I needed something to reduce my weight. So I went to keto diet. The keto diet is not easy. The same way it's not going to be easy for you in this, but determination. Whenever I want to do something, I count these three things: determination, perseverance, and hard working. This will pave a way for you. So the first day I did the keto diet, I nearly collapsed, honestly speaking. Can imagine yourself that when you wake up in the morning, you enjoy this, all of a sudden you wake up, you eat only broccoli, you drink water with oil. I nearly fainted. I wanted to give up, but I said, then I must do this for me to regain myself. I did it for 1 month and I saw the result because I didn't cheat. So if you are doing it, temptation will come, but you need to do it. Just see it as, I know why I'm preaching this. See it as something that you are doing to help yourself, something that you are doing to restore your joy. Because if the fibroid should shrink or go away or stop growing, then you have a best opportunity of becoming pregnant. And but especially not only becoming pregnant, the discomfort, the pains you pass through each time you are seeing your menstruation, they will stop. So this is the first thing that you can do to um to what do you call it, to shrink the fibroid. Now let's go to the practical aspect. That first one, this first one I mentioned is the best. Is the best. Is the best. Is the best. If you can do it, avoid these things for 6 months. If you have large fibroid, after 6 months, go back to the test and you will see the doctor or the scan can tell you, will tell you that either the fibroid is no longer there or the size have reduced. You yourself, you will even notice it because most of those symptoms might not be there. So the practical aspect now, you're right. Are you ready? If you are ready, you say yes, let's go. If you are ready, you say yes, I'm taking time because I will soon leave. So the practical aspect of, for those people that are asking me, ma, what can I drink to shrink fibroid? What can I, this is what you can do. But then the first one, like I always say, is the best. The first thing, you get your water, right water. You get your ginger. I will demonstrate it when I have time. Honestly, I don't have time to be, in fact, to be honest, some people like cooking. Me, I'm not the type of person. If it is not marriage, I'm not the type of person that like cooking in the kitchen. That's why sometimes to demonstrate all these things is always difficult for me to demonstrate them. I don't have most of the ingredients that I'm going to mention here. That's why I'm not demonstrating it. But anytime I'm able to get it, I will demonstrate it live. So that number one is water. You get your water, ginger. You get your ginger, turmeric. That turmeric should be 1 teaspoon. Ginger, 1 tablespoon. Then black pepper. You know what black pepper is? Another one is this oregano. I will spell oregano. Oregano is a spice that is used, is among the mint family. And the benefit of that oregano is very good. It contains antioxidants that help to fight against damage in the body. It also helps to fight against infection. It also help to fight against bacteria. So I want to show you guys the picture of this oregano that I'm talking about. Maybe later on I'm going to still post it. This is the oregano. It's a spice that is used in cooking. This is oregano. Oregano. I wish if somebody's here, if you are here, you can write this. Please write it. The oregano is spelled O-L. Oh, I'm speaking in Dutch. Oregano. Please, if Yunwa or somebody, Sarah is not here today. Please, can you write down this spelling, this oregano that I just mentioned? O-R-E. Why am I speaking Dutch? In Dutch, they call R-O-R. Sorry. Oregano. Oregano is a spice that is used in cooking, and this spices belongs to mint family. And you know that anything mint, anything hot help to shrink fibroids. So the measurement of this oregano, I don't have smart people here. That's why I like Sarah. I wonder why Sarah is not here today. I don't have smart people. Write down this thing so that people who didn't get the spelling can get it. Yes, somebody have written it. Epan blessing. Epan, thank you. Epan have written it. So that is the spice. You can buy it at any spice store. If you can see the fresh one, please buy the fresh one. The fresh one is the best. The fresh of this oregano is the best. So we have for people who always like taste, who always like taste, because when by the time you boil these things, you put them together. When you bring the ginger, you use your this thing to smash the ginger, 1 tablespoon of the ginger in your pot. Then add 1 teaspoon of turmeric powder, black pepper. You put a bit, this oregano, 1 teaspoon. Then for people who always like sweet things, there are people that They cannot eat anything. But remember, you are fighting against something, so you don't need to, you need to avoid anything sugary. So, but if you want to add taste to it, you can put honey, but it's not encouraging for you to take honey. Avoid drinking cold water. Avoid drinking cold things. If you have fibroid, make sure that anything that you are taking should be warm, because when you are taking cold water, you see that the blood will be coming out in a clot form, which is not good. So do this, do this, do this. Yeah, this recipe, this drink for this shrinking of this fibroid, before you can see the result, you must do it at least 1 to 2 months. You drink it 3 or 2 times a day, depending on your ability. First thing in the morning, last thing at night. Drink it. Don't do today and leave tomorrow. You must do it consecutively 1 to 2 months before. If you have cyst, anything I'm talking about here, including the remedies I gave for fibroid and cyst, they are the same family, depending on the type of cyst you have. So this juice, you need to drink it for at least 1 month, 2 to 3 times a day before you can see the result. Remember, you are fighting battle with fibroid, so you need to not taking today, tomorrow you will not take. If you really want to see the effectiveness of anything that you are doing or taking, you must be consistent. You must be doing it frequently for you to see the result. If you do today and leave tomorrow, the first one you did is useless. It's not going to be effective. But if you continue doing it, your body will be used to it. Okay, let's assume now you combine these things together. Maybe you are the type of person that like eating meat. Every day you eat meat, and you stop eating meat, you stop eating dairy food, you stop drinking alcohol, you stop caffeine, you stop processed food, you stop sugar, you stop green vegetable and fruit. The time the fiber and at the process of doing this, you are taking this recipe that I said. The fibroid itself will be confused. The fibroid will say, what is happening to my body? If you do it 1 month, you will see yourself being happy. Instead of eating, you have a problem. The reason why some people will be in their menstruation, they will still be drinking drinking cola, drinking malt, drinking all those things. Instead of drinking, make this juice your zaft, your tea. Your tea. These things are listed here. Make them your tea. When you wake up in the morning, if you anything you want to eat, if you want to eat bread, please take brown bread. Brown bread, brown bread, but don't eat them too much. Take brown bread. After you drink this thing 30 minutes, the thing will go to your system and work. When you start it newly, it's not going to be easy for you, because just like you changing your lifestyle, you might not find it funny, especially when you go for an occasion. They will bring out these things. You will be looking at the food that you used to eat before, and you cannot you cannot have them. I know how painful it is, because I've been there. I told you guys, when I did a keto diet, I was just praying to myself. I said, 1 month will finish, I beg, let me go out of this punishment. But I achieved my goal, because I was determined. So if you are determined, you can make away with the fibroid. Another way you can get away with the fibroid, that is large fibroid, is by surgery. But trust me, surgery is not the solution to it, because it can grow back. At the process of the surgery, you can develop other faults. Some people during this process, they are choose. I'm not trying to create fear, but what I'm trying to tell you is that surgery is not always the best. It's not always the solution to fibroid. But if you are in a modern world, European world, and you have fibroid, You can also try removing it because they are very, very careful. I've seen a lot of people who remove their uterine fiber, that is the one inside your womb, because if you don't remove it, if you don't dry them up, sometimes they don't prevent you from getting pregnant. But if you eventually become pregnant with them, you will be seeing hell on this world. The thing will disturb you. I said you are going to boil it, cook it for 15 minutes. When you add all these things, water, ginger, turmeric, water, you can take 1 cup because it's something that you will drink immediately. Or maybe you can make the ones you can take in a day. Like myself, whenever I want to cleanse my uterus with what do you call it? Um what's the name of this? So when I want to drink my uterus, I've forgotten the name of this. I always make the ones I'm going to take and for the whole day. You can add 2 cups, or depending on how many days you want to be, how many times you want to take them a day. You can measure the water, 3 cups of water. Then in this glass of water, you should know that each one will contain, let's say you are using 1 tablespoon of ginger, so which means you are going to add 3 tablespoons of ginger, and 3 teaspoon of turmeric, and black pepper, not too much, oregano, that spices you add 3 teaspoons, because it's what you are going to drink 3 times. You can make the ones you are going to drink in a day and leave them so that whenever you want to take them, you can be taking them. Yes, but don't add apple cider vinegar because this is fibroid. If you want to take apple cider vinegar is more of cleansing. Apple cider vinegar is always more of cleansing your uterus. But in terms of fibroid shrinking, fibroid is afraid of anything that's hot. Estrogen feed on sweet things. So you cook it, not soak. You cook it 15 minutes, then when it gets cold, you take it. So please, any question, any other question, because my time is up. Any other question? Any other question? So in the absence of no question, we are going to call it a day. If you know somebody that is suffering from fibroid, you can send them this video, let them watch and see how they can help themselves apart from undergoing surgery. So I wish you all the best in this journey, because it's a journey. Comfort, oh, thank you. Comfort, you are welcome. This is a journey, but I believe you can do it. You can do it. You can do it. No matter where you are, you can do it. All you need is perseverance, consistency, determination. You will get there. Within 6 months, you will tell me, my fibroid is not there. If you have a small fibroid like 2 to 4 centimeter, if you do this before 6 months, you will not see it again. I have told you, green vegetables, they are good in the body, but they are helping estrogen to grow. Yes, I said it. You should avoid fruit because some of the fruits, these are for people who have fibroid. Though, if you have fibroid, you should avoid them. These food and vegetable, they are good. If you don't have fibroid, it's good. But if you have fibroid, these things help. Some of the vegetables and fruits have toxicity and they have natural sugar that enhances the growth of the estrogen, which can help the fibroid to grow. No, 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 no. Please, if you know black pepper, send Ife Yinwa Nwoko the picture of black pepper. Black pepper is not that one. Black pepper is something like Oziza. Oziza, I think it's Oziza. Chinwe gift, this your question. Go and make research by yourself. If you ask me such question, I will block you. If you don't know the vegetable, you forget about it. I will do everything for you. If you cannot find it, forget it. Really? Wow. Boss Adeboyo, what did you do? Did you watch my video? God bless you. This is what I'm telling. See this person. I have made a video on my YouTube, even in this Facebook. I made a natural recipe on how to cure fibroid, just like the one I'm talking about. But why I added these things is for people who have large fibroid. Adeboye said, I'm just coming from the hospital. I was told I don't have any fibroid. Thank you, ma'am. You are a blessing to me. God bless you too for listening, for doing. Some people are here just to ask unnecessary questions. They won't pay attention. People who watch, if you are not here, maybe you are working, if you come back, sit down and watch the video. Don't come and be asking me unnecessary questions. That's why you see me, anything I said, I repeat it so that you can hear it. So Boss Adeboye, we give glory to God, and I also thank you for listening, at least listening and doing. Some people want me to tell them and also come and do it for them. My own, I've done my own part, which is to teach you what you should do. If you think it's not my problem, I'm not the one suffering from it, I have rendered my help. If you think the video is for you, listen. Even if you didn't understand this teaching, when I off the live stream, you can go back, rewatch it, pay attention, and do it within 1 month. Deboye, what did you do? Which of the recipe did you use? Can you tell them here before I off the live stream? Can you tell them what you did? Is it the apple cider vinegar and ginger something? I've made several videos about this. Sometimes I forget because I always have new people. So God bless you. God bless anybody that will do this thing faithfully. And my prayer for you, as you are doing it with your heart and without cheating, not drinking this one, you go and drink faster. God will answer your prayer and heal you naturally. So, my dear people, my time is up. I need to go and pick my children. If I have time tomorrow or next. If you haven't, in fact, go and subscribe to Tochi's channel on YouTube. This is the easiest way you can watch all the videos, all my recipes, natural recipes, because sometimes if I don't want to waste time, I do it and post them there. So, Boss Adeboye, maybe you write them in the comment section. Even as I'm going to off this, they will read your listing and know what you did. Which of the can you write the name? Okay, the apple cider vinegar. She said I did a video on how to remove cysts and all this with apple cider vinegar in Tochi's channel on Facebook. No, YouTube. Just rush there now. Go and do it. You might combine it. It will work for you, and you will come and return the glory to God. I love this information. Not even I will try it. I will try it is not a word of encouraging yourself. Say I will do it. So bye bye, my people, until we meet again.